Mhm.
Hello, everybody. Welcome to another episode of What's Next After BDS. And today I have with me Dr. Shruti Kasturi, a dental surgeon from India who has now gone to the Germany and pursued her dentistry. So, Doctor, can you please give a short intro about yourself?
Yeah, sure, Dr. Vinay. First of all, thanks for having me on your YouTube platform. So, I'm Dr. Shruti Kasturi, and I'm a dentist right now practicing in Germany. And it's been around 2 years that I've started practicing, and right now I'm on my maternity leave and in India for now.
Okay. Okay.
So, I'm 2016 passed out from Chettinad Dental College.
Okay.
Yeah.
Okay. That's fantastic, Doctor. So, the first question which I'm going to ask you is why Germany? Is there any specific reason you opted to, have your career to be continued in Germany?
To be honest, no, I am not a person who is actually having all sorts of what is that idea to go abroad or start learning a new language, because we all pretty sure know that going to Germany means learning a new language, German.
Okay.
So I was not actually interested, but God had other plans. I was married to a guy who was working in Germany,
Okay.
so
So
I
that
had to
means
move here.
the first heads up is like if you want to practice in Germany, you should know German, right?
Exactly.
Yeah. So
You
that's
have to breathe. That's
okay. Okay.
so straight.
Okay. So is there a specific exam you have to clear to know that you're proficient and fluent in German, or how do they recognize that you're qualified to speak or write in German?
So basically, the whole process starts with us learning German.
Okay.
There are different levels actually. Learning a language means you have to go through different levels, like the basic level, then the intermediate level, then the higher end levels, and then near native level, native level. So there are different levels. So the same goes with German also. Basically, you have levels like A1, A2, B1, B2, C1, C2, and all. So basically, for our profession, we'll have to learn till the language of level of B2,
Okay.
B2 of normal German, and C1 level of dental German.
Okay. Okay.
There are different. I mean, there's a slight deviation when you go to the C level,
Okay.
but till that you will have to learn the normal fluency. I mean, the normal German that you have to that other people learn also.
Okay. Okay.
For all the professions, it's common till the level of B2. Once you reach the level of C1, you'll have to be very subject specific, because you'll have to know the words that you use normally in your practice.
Okay.
So that is called as dental term.
Okay. 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 So now, if I may ask, so you learned this levels of German first and then prepared for your exam, or is the exam is going to be also be in German, if I suppose, right? Your exam is also going to.
Yeah. Okay. Obviously.
Okay. So how long does it take for an average person to finish these levels in German? Like, say, as
So
someone.
I think we'll go like this. Okay. Basically, I'll tell what is the process first of all
Okay.
and how to go about it.
Sure. Sure. That would
So
work.
basically, learning German is the first step
Okay.
towards practicing in Germany. After which you will have to write two examinations. The one is called first one is called as FSP, or Fachsprachprüfung, or to be very clear for an English audience, I would say it is exam which tests our German dental knowledge.
Okay. Okay.
I mean, to be more precise, they expect how good you are able to empathize the patient and show sympathy to a patient in German.
Okay. Okay.
Being being a non-native speaker,
Okay.
that is what is being tested. So that is the first exam, and it's called FSP. And the second one is going to test your dental knowledge, like how do you how good you know the subjects, what are your skills, and all
Mm-hmm.
that. That is
Okay.
the licensing exam. That's called Kenntnisprüfung, or the Approbationsprüfung, or the Gleichwertigkeitsprüfung. And yeah,
Okay.
these are the similar names to the same exam.
Okay.
So yeah,
Okay.
so
So
these are the process.
okay.
So the process begins with us learning German from A1 to B2.
Okay.
In my case, I had to I did not do any level of German here. I started learning my German in Germany only. I was
Okay.
married. I got my spouse visa. I went to Germany and then started in 2017
Okay.
to start learning German. So, with your question, how long does it take? It normally takes around a year from A1 to B2.
Okay.
1 year, 3 months. So, see, the basic levels, nobody can judge you. Like, you can learn it in 15 days, you can learn it in 10 days, you can learn it in 12 days, you can learn it in 2 months or 3 months. So, the course is structured like you have to learn it in 45 days, 90 days, and stuff like that. And in Germany, especially, you have something called UE or Unterrichtseinheiten, means you will have to sit a particular number of hours for every level
Okay.
in the class
Okay.
just to write the examination.
Okay.
But for the basic levels, you are given concession. Like if you already know to speak a bit of German and if you're really good at it, you can go give the examination.
Okay. Okay.
Basically, you have to write the A1 exam, pass it, then A2, then B1, then B2.
Okay.
But what certificate is really important is B2. Even if you don't write other exams, just prepare and go to the next level. Just prepare and go to the next level. You will have to have your B2 certificate for the whole process to continue.
Okay. So for someone who's just wants to shift to Germany, the first thing is you need to learn German and then even think about settling down or practicing dentistry. That's like very well said here. Now, for as far as these courses are concerned, are they sponsored or rather suggested by the German Dental Council or what is the name there, or you can do it by yourself privately? I'm talking about learning Germany. I'm sorry, learning German.
Yeah. You are talking about the language, right? The German language exams.
Language.
Okay. So basically, to learn this A1 to B2, there are a lot of modes.
Okay.
There are a lot of teachers out there, private teachers, and especially when you go on a spouse visa, you get a lot of concessions from the government itself to
Okay.
learn the language because you have to integrate
Okay.
quick into the German culture, society, and stuff, right? So, a lot of municipalities there in Germany, including cities and townships and towns, they provide this integrations course or like integration course,
Okay.
wherein the spouses or the family of those who are already working in Germany are given a chance to learn the language.
Okay.
So that is how it starts basically. But if you are someone like you have come alone, like you are going first and then you want to bring your family, the other way around, not like my case,
Okay.
then also you can actually go take classes there. There are a lot of institutes, either public universities are there. There are universities which offer these courses. There are public, what do you call, offices which give these courses, not universities, but there's something called as Volkshochschule, which means people's evening classes, university kind. It is not a university, but it's a place where people who wanted to learn new skills or new languages come during the evenings to learn new things.
Okay.
So there are institutes like that wherein they can learn, and this is government aided or like funded, basically. But there are also a lot of people who are offering these sessions right now.
Okay. So
Like
now
A1.
I'm done with the language. I've mastered myself. So I'm proficient with the exam. I'm sorry, proficient with the
Yeah.
language. So the next step I would like to know is like now, if I am not wrong, so you're going to read your entire dental syllabus in German, right? So you'll have some set of books and some protocols and guidelines according to which the German Dental Council works, right? So how different was it from the Indian dental syllabus, and what is the pattern of the exam? Is it like a single part or two part? Does it have an online and a viva written? Can you just walk us through that part?
Yeah. So once you're done with this B2 level of German exams, the next is going to be your FSP. Here, as I told you, your German knowledge is tested rather than the dental knowledge. Here, it's going to be a three-part exam, a single day exam. In the same day, in about an hour, you will have three different parts, wherein one doctor will be acting as a patient, like your OM, oral medicine and radiology kind of final year kind of viva, wherein the doctor will play a role of the patient, and we'll be playing the role of a dentist. Take all the case important things, no case histories and stuff like that. Just jot it down on a piece of paper. And the second part is going to be schreiben, or like writing down everything, whatever is already there. I mean, the case history. Then the third part is going to be the doctor Gespräch or interview between the two people. And as I told you, how empathetic you are and how sympathetic you are and how much you are present in the moment. Because uh, there are a lot of people what actually is being examined, because I take FSP and KP classes right now. So
Oh,
I
that's
have quite a lot of students who are thinking from my own academic kind
okay.
right now. And I also offer A1, A2 and B1 classes right now. So it's like the whole process I do it for people. So right now what actually is being tested is like how good you are able to present yourself in a moment of distress
Okay.
in
Okay.
a foreign language.
Okay. Okay.
That is being tested in the first part.
Okay.
Although there are three different parts, all what they wanted to know, all what they wanted to understand is how good you are able to manage the situation.
Okay, okay. But sorry, doctor, just one point here. See, suppose a patient presents with a wisdom tooth pain, okay? So we're going to ask him a couple of questions regarding, I'm talking about the general protocol here. So we're going to ask him about the chief complaint. We're going to ask him about the medical history. Then if he's willing for the procedure, do it on the same day, or then he prescribes some medication, ask him to come on a later date, right? So this is the usual protocol here. Now, can you tell me like how much can I be empathetic for a wisdom tooth, or is it going to be some serious situation where you have to be more empathetic, something like oral cancer or something like that? How does that work? I
No.
got your point of empathy, but how does it work?
See, the basic thing is, for example, you are treating a patient. See, wisdom tooth means that patient is not going to be really very old.
Okay,
So yeah, I'm talking about cases wherein an old patient comes, say 68-year-old female
okay,
or a
okay,
male. He
okay,
comes in. You have to show him gestures like, yeah, please take your seat. What is your name? And if he says, my name is Sieglinde Muller or something like that. See, exactly to be very honest here, we also have names in India, especially we both are from the same state, right? Tamil Nadu. So we have some names which are not or lesser known, not known so much or lesser known nowadays.
correct, correct,
But being in the same state for a long time, we know that these names exist and we know the spelling.
correct, correct.
Especially from our country, the same name Shruti is written in different, what do you call, with different
Spellings
spellings.
and pronunciation.
The main thing is here, what they actually check is you have to be little um, open and ask them, see, I'm sorry, I'm new here, I'm an expat here, so I cannot understand the name that you're trying to say. Can you please pronounce it for me?
Okay,
Can
okay,
you please spell your name? Sieglinde. So how do you write this? Sieglinde.
okay.
That's how it functions.
So
And if you're
maybe
not able to see, see SI is of English, and if you want to say the same of German or Deutsch, it goes like SAEGLANDE. So when you're not able to understand what I'm trying to tell, you
Mhm.
have to be empathetic to stop them and tell, I'm sorry, I'm not able to get it again. Can you write it for me?
Okay, okay. Got it,
In
got it.
Germany, it is
Okay,
mandate that the people who address the people with the right name, the right pronunciation, and right thing. No, it's a little bureaucratic country, so you will have to be very careful with their data. You
okay.
cannot write your own spelling and tell, okay, this I think this is the same patient that I handled, because everything is perfectly maintained.
That's it.
Cases is maintained, registers are maintained. Even like after 10 years, you are able to talk about the patient that you examined on 27th or 29th of July, for that matter.
Okay. So that is the first
2023.
part
So
you're talking.
that is very important.
Yeah. Yeah, please. Sorry. You're telling something. Sorry.
Yeah, that is the empathy that they expect.
I got it. So, okay. So that's with the first part. What is the next step with respect to the examinations? And is there a name for this examination? I think you told me already, the one in the you
That's
pronounced
called
in German, right?
FSP. FSP.
Okay.
Short form is FSP. So
Okay. So what is the next step in the examination?
so you write the three parts, as I told you.
Okay.
This is the first part, like you ask the questions, jot down these stuffs, and the second part is going to be writing, and the third part is going to be uh, talking with the doctor himself, like telling that, okay, he'll ask you, Dr. Shruti, tell me about the case that you examined today morning. The patient named Sieglinde, aged 68 years, had come to the office. Can you please elaborate on the case? That is
Mhm.
how it usually starts.
Okay.
And, people, we'll have to talk about what happened, on what was the case, why did he come here, his things and all. And from there, questions starts to emerge.
Okay. Okay.
And everything is basically concentrated on how good you're able to answer in German.
German. Okay. Okay. Okay.
And again, I'm telling you, please forget about English here. When you start preparing for German licensing, you have to breathe German. There is no point or no way that you ask the question if it is in English or in German. No, there's no use of you speaking in English in Germany. There is no use,
I think it's
literally.
a very valid
That
point.
is how it works.
Something which has to be kept in mind for anyone planning to, shift to Germany for their dental career. So is that all
Exactly.
the exam process, or is there more to this? And like, how long do you need to wait?
Once you once you pass this, I mean, passing, you get to know another 10 to 15 minutes, you know whether you pass the exam or fail the exam. So
Oh, okay, 10 to
you
15
ask
minutes.
for
Okay, okay,
yes on your face directly on the same day. They
okay,
tell if you pass or fail, and when you have good luck and stuff like that, and you pass the exam, then you'll have to wait for another couple of months and get your invitation to write the Kenntnisprüfung or KP.
okay,
Usually, it's a three-part examination, and that is going to be Schreiben or the writing part, the first part. The second part is going to be Mündlich or oral, and the third part is going to be Praktisch or practicals.
okay, okay. So, and okay, now I understood like the concept. So you're good. You need to be like familiar with German, be empathetic, and all that, right? So, for example, when I'm training students for the MFD exams with respect to Royal College of Surgeons, see, basic
Mhm.
dental is going to be the same, right? The tooth numbering system is maybe slightly different. Maybe they have slightly different protocols when it comes to a certain procedure and all that. So, was it like, was there a vast difference between what you learned in India and German with respect to protocols? Or is there like only minimal changes like here and there?
There are only minimal changes, but to be honest, I went to Germany, and when I started practicing, I did not have a lot of what do you call it? I did not have access to a lot of instruments like how I had it in Germany. So everything was new to me. I did not know how a hetero scanner works. I did not know how to scan the tooth right now. I just knew to take impressions, the good old impressions.
Okay,
So
okay,
that is how I was taught here. And to be very honest, I would actually like to talk about this. I was really embarrassed the first day for not knowing how to load the anesthesia because I've never seen an injection like that. All my life, I used the plastic one which was available in my college.
okay.
So there, I got to use something which was mentioned in this anesthesia books, right?
Okay, okay.
Whatever we learned,
The way you reload the
something
cartridge, right?
exactly the cartridge type. I did not know the first day. I did not know how to load.
I have used it a couple of times in a few clinics where I was as a visiting consultant. But initially, the first
Yeah,
time, I was also like not sure of how to use it actually. Then they told me how to get it.
exactly. Because they told me you'll have to. Can you just show us if you can remove the teeth? Like I think it was 3 6
Okay, okay,
partially decayed. I was very happy to show my skills, and I was very happy. Literally, the first time they are allowing me to do this, but I was so embarrassed because I told them, "Sir, I have never used this kind of cartridge-filled anesthesia needles. That was different." And I think there that was one main difference that I saw in the initial days.
okay, okay.
And to be honest, that depends on what kind of clinics you work also. Because I started working in a really posh, modern, very big clinic, and I
Okay,
started my practice.
okay, okay.
So that also depends because if you work in a small dorf or like small village,
Mhm.
and the doctor is like only one doctor there, and he doesn't have a lot of cases or patients, and he uses only the old methods, then it's good. But to be honest, 90% of the time it is the same what you do in India. But
Okay,
one vast thing, what I found it different was, at least what I knew, we do perio problem first and then handle endo.
okay, okay,
So that was one of the differences that I see.
okay. So once you're done with these exams, are you allowed to have your own practice, or you need to work under someone and then set up your own clinic? How does that work?
So that actually happens like once you are done with this KP exam, you will have to do a 2 years assistance site
Okay,
under a doctor,
okay,
which
okay,
means, and he gives a green signal to the Kassenzulassung or Kassenzahnarztliche Vereinigung. That is how they call KZV. he gives a letter to them stating that, okay, this girl is good, she's good enough to run her own praxis, she has not made a lot of mistakes and stuff like that. Once he gives that letter, and this is usually given very easily, and once you're done with your 2 year assistance period in any clinic, you can get your KSB number and start your own.
Oh, okay, that's nice. That's nice. And what about see, once you're done with your undergrad, are there prospects for you to do a post graduation also there?
Yeah, naturally. There are a lot of options to do your post graduation also there.
You need
Like the same.
something like our NEET, or how does it work?
No, that doesn't function like me. There are, like, to be honest, different methods of doing your masters.
Okay.
Masters in India is only MDS, and to what I know is diploma, or like this 1 day courses, hands-on courses and stuff like that. There also you have the same.
Okay.
You have masters, but you don't have masters in all the eight, nine subjects that you have it here, like in India. But it is like you have it in oral and orthodontics. You have it in periodontics. There is one course in laser dentistry, masters. Then there is one course for surgery. And oral surgeons, you have to understand that oral surgery is quite different and difficult in Germany. It is because you can do only the oral surgery part.
Not the
You cannot do the
maxillofacial part, right?
You will have to do the medicine examinations also along with your
That's how
degree.
it works in most of the European countries, I believe. They are specific when they
Yeah,
say oral surgery. Doesn't include maxillofacial.
yeah,
Okay.
yeah. You cannot do this maxillofacial thing. So it's like you have to do only the oral. That is the normal masters.
Okay.
After which you can also do something called Weiterbildung. Weiterbildung is available in almost in all jobs. Every job has a Weiterbildung. Like you be an engineer, you be a doctor, you be whatever. You have something called Fortbildung and Weiterbildung. So Weiterbildung is nothing but one more specific skill. No, you just add, which is very important for your daily practice. You are just going a step wider in your practice. That
Okay.
is called Weiterbildung. So you're building something for your practice.
Something like a
Um,
promotion?
yeah, kind of
Okay.
thing that you can do. Promotion here in Germany means PhD or something like that. You have to do it in a university.
Okay.
That is
Okay.
also there.
Okay.
But this Weiterbildung courses, you can do it from the state's Czar Arztkammer or Dental Council in which you're registered to.
Okay.
There is, each state is known to give few different options. Like few states give orthodontics, periodontics, pediatrics, and all sorts of things. But not all states give all the opportunities. So it
Okay.
depends on which state you are and wherein you can do the Weiterbildung. That is one option. Then there is also an option wherein you can work under a doctor part time, and you can also go to the he's affiliated to a university, and you work under him for the practical part and go to the university for like few days in a year and get the degree and work under the same doctor for 3 years.
Okay.
This part is really difficult because even Germans find it hard to find doctors who are affiliated to the university. It is very less.
Okay. Okay. So that is like a lot of options there, right? After BDS. And Doctor,
Yeah,
just
yeah.
two more questions. One is like, how much does it approximately cost? I'm not going to talk about shifting to Germany or the flight tickets, just the examination process and the courses alone in INR. It,
Mhm.
how much does it cost?
To be honest, that varies every year. I
Okay.
cannot give you
An
even
average, a range or something.
average value. To be honest, because when I wrote, as I told you, I have a service offering right now. Who there are people coming out of every state
Okay.
for me from my academy right now who doing FSP and KB. So it actually varies from state to state.
Okay. Okay.
It can cost anywhere up to 250 euros to 600 euros for FSP.
Okay.
Just writing the exam for FSP. For
Okay.
preparing, it depends on where you go, which classes you take, and stuff like that. Learning German is a whole different setup. For that, you'll have to spend.
Okay.
And that the cost for learning German also depends on where you're going to learn, either India or in Germany, either
Uh-huh.
online or offline. So all that matters.
Okay.
So that cost is also there. So for FSP, fees alone for writing the exam is around 250 to 600 euros, and it depends on what state you choose.
Okay. Okay.
And for KP, it can cost around 400 to 1000 euros per what do you call per part.
That part. Okay. 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 That's quite expensive, but I think
It's expensive.
it's worth doing it because you're very passionate about what you're doing and you want to continue it in another country. I think you can do that. Now, just two more questions before I forget. One thing is like you told me, right? Once you clear the exam, you have to work as an assistant to some doctor, right? For a couple of years before you consider your own practice.
Mhm.
Now,
Mhm.
are there opportunities apart from working as a assistant, something like a dental technician or a, for the nurses basically like that, someone who cannot afford but still wants to settle down in Germany?
Yeah, there
Like
are
the
a lot of options. There are a lot of options. To
okay,
be honest, this alone should be like for you can talk for about an hour, but few options that available are. I'll just spill out the beans like
sure,
what are
sure, sure,
available,
sure,
and
sure. That
I
will be
don't think
useful.
I can talk so much about everything. You can work as a dental hygienist.
Okay,
Hygienist, in fact, is a Weiterbildung of ZFA or what do you call it? Here, those who mix cement to us, they help us, right? Here
okay.
in India. I don't know
Yeah,
if you have a name to
we
give
don't
it.
have a name. We don't have a
Someone who
name.
dental
Yeah,
assistants.
dental assistants.
That's how
Correct,
we should.
correct,
Yeah,
correct, correct.
we don't have any degree or like a diploma for them. But in Germany, it works doesn't work that way. You
Mm-hmm.
have to have a 3 year Ausbildung or a 3 year diploma course for these ZFA or dental assistants.
Okay, okay, okay.
That you can work there. In few states, those who are not trained to become ZFA or has not done their 3 year diploma can also work as a ZFA because they face a lot of shortage right now. So
Mm-hmm.
they wanted a lot of people to migrate to Germany and work as a dental assistant. They are actually in search of a lot of people. And if someone is really interested into this, they can always contact me. You can give me, if you give them my Instagram handle, sure. Maybe they can contact me. I can help them out.
Sure, sure. So that's what I'm about to ask you. Is it okay if we can share your email ID and Instagram handle at the end of this session so that people, I guess I have helped you out with the pathway towards German, but even I haven't got the hang of the names of those exams. I think you can contact Dr. Shruti. She'll be more than happy to help you
Yeah.
out there. Yeah, is it okay? And is there something which you feel the audience should know, something which I have not asked you about, which could help them?
I would
I missed out on
actually
it.
suggest that, yeah, yeah. To be honest, this is the process. Learn German, write the exams, come to Germany. This is the process as simple as it can be. There are
Okay.
a lot of nuances here and there that you have to know. Only after which you can clear the exams and stuff. But remember, the goal is to practice in German.
Okay.
It is difficult. And to be honest, know the facts, know the pros, know the cons of working in a European country because you get a lot of benefits other than, and there are also a lot of cons because in a country like USA or Canada, I think at least to what has been said, you earn a lot.
Okay.
Personally, I have not visited any country nor have I worked there, so I don't have any idea. But that is how we have an image like dentists in USA are paid really, really well. I don't know about their life basically there, but to me, as a dentist, as a mother right now, and as a wife, I find Germany the perfect place
Okay.
to live and even to I would say settle down because family moments and your personal life, right, is always
Mhm.
very well.
Very
At the
well.
end of the day, that is very important what I think.
Okay. Okay.
Earning is one part of your life that's very important. Your career is very important. But Germany gives an opportunity for me to earn and at the same time have a very good and solid time with my family.
The how do you call it? Work life balance. Yeah.
Balance. Yeah.
Okay.
That's very, 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 very good in Germany. I would vouch for it. Especially for mothers, for new mothers. Germany is a great place. Once you know that you're pregnant, you get something called Beschäftigungsverbot. That's how it's called in German. From the day that you know that you're pregnant and you get a letter from your gynecologists, then you are given a full paid leave
Wow. It's
till the
fantastic.
day you deliver. And 8 weeks prior to your delivery and 6 weeks after your delivery, you are given full. I mean, all these are with full payment. Okay, your normal pay.
So you can basically say finish your exam and then plan for your family, right?
That's a great thing to do. That's a
Amazing.
great thing to do. Start working and then you can
Doctor,
think
there
of
is
all this.
one more question. This actually suddenly it struck me is like when I was talking to another doctor who's practicing in Malaysia, where we Indians or any foreign candidate cannot practice unless you have Malaysian citizenship, even though if you're willing to do their internship or they don't have any exam. But if you have your postgraduate degree, you're allowed to work as a faculty and teach those students there. Are there any such options in Germany where if I have my PG like MDS or am I allowed to work as a faculty there or something like that?
To be honest, no.
Okay.
And Germany is a expat-friendly country. There's nothing like you have to have a citizenship to work there,
Okay.
basically. And one country wherein I went through spouse visa, right? So from day one I arrived there, I was legally allowed to work,
Okay. Okay.
except your job comes under a council.
Okay. Okay. Okay.
My job is a regulated job. Being a dentist is a regulated profession. Only these regulated professionals cannot practice from day one. So
Okay.
other than that, if you are, for example, a software engineer or IT person, you can work from day one. That is one boon in countries like Germany.
Mm-hmm.
Okay. So once you are Germany with your spouse visa, you can start working. But for someone who wants to practice there as a faculty, I think you have to have great level of German. So imagine sitting in a classroom with hundreds of German natives, then you should be in a position to teach them in German. Then imagine how good or great of your German should be.
Okay.
So that is very important.
So if you're fluent in German and if you have a postgraduate, then probably you might be considered.
Yes, naturally you'll be considered.
Fantastic, doctor. Thank you so much for your time, Dr. Shruti. It was a real pleasure talking to you, and I'm going to share your email ID at the end of this session. So in case students or any dentists want to contact you regarding the process, I'm sure you'll be happy to help them out. Thank you for your time. It means a lot.
Thank you. Thank you.